All right, today we are tackling a huge topic, but we're going to use a really simple tool to do it. We're talking about innovation in healthcare and how we can measure it with something we're calling the healthcare scorecard. Let's get into it. You see it all the time, right? Every day there's some new headline about a game-changing technology or a revolutionary new treatment, and it's awesome. But it brings up a really important question. Beyond all the hype, how do we actually know if any of this stuff is making a real difference? To really get past the marketing spin and understand what the true impact is, we need a consistent way to grade these things. So think of it like a scorecard with just a few key categories. And that's exactly what we're going to do. We'll build out the ideal scorecard, and then we'll see how that stacks up against what we're actually doing in the real world. Okay, so first things first, and honestly, this is the most important part. We have to look at the human impact. This is the whole point of any healthcare innovation, isn't it? Does it actually make people healthier? So, the crucial point is, how do we measure this? Well, you have to ask four pretty fundamental questions. First, the big one, does it save lives? Does it reduce mortality? Second, does it make the disease less severe? You might hear this called reducing morbidity, but it's really about lessening how much an illness weighs on someone's life. Third, what about their quality of life? Does it improve? And finally, a question we sometimes just totally forget. Do the patients themselves feel like it's helping? But here's the reality check. Getting solid, concrete answers to those questions, it's not easy. Not at all. It often takes years and years of really detailed, controlled studies to gather the data you need to prove an innovation is truly effective on that human level. All right, so improving patient health, that's number one for sure. But for our second category, we have to look at the system itself. An innovation can be amazing for one person, but it also has to work from the inside out. How does it actually improve the healthcare system as a whole? And you can really think about this in two ways that are totally connected. On one side, you've got operational efficiency. Is the system running smoother, faster, maybe even smarter? And then on the other side, you've got the financials. Do the numbers work? Is this thing sustainable in the long run? They're really just two sides of the same coin. And this table kind of breaks down how we measure that. For efficiency, we're asking things like, can we see more patients now? Are we cutting down those awful wait times? And this one's critical. Does it make life easier for the staff and maybe reduce burnout? Then on the financial side, it's just as direct. Is it bringing in new money? Is it cutting costs? And, the bottom line, is the return on investment actually positive? Okay, so let's say we've got an innovation that improves health and makes the system better. We're done, right? Well, not quite, because none of that matters one bit if people don't actually use it. This is the adoption test. And adoption isn't just a simple yes or no. It's more of a journey. First, what's its reach? Like, how many people are even trying it out? Second, what's the depth? Are they just scratching the surface? Or are they really digging in and using all of its features? And third, what about persistence? Are they still using it 6 months down the road? A year later? And I think this quote it sums it up perfectly. Without people actually using something out in the real world, day after day, even the most brilliant medical breakthrough is just an idea on a shelf. The impact only comes from usage. This brings us to our fourth category, and you could argue it's the most important one of all, equity. Because a true innovation can't just work. It has to work for everyone. So what do we actually mean when we say health equity here? It boils down to a pretty simple but profound question. Does this new tool, this new treatment, benefit all parts of society? Or does it accidentally leave some people behind, only serving a privileged few? And to answer that, you really have to look at the potential barriers. Does the innovation actually improve access for communities that have been historically left out? Or, and this is a scary thought, does it make the existing health gaps even wider? We have to think about things like cost, right? And whether you need to be a tech whiz to use it, or even if it's available in different languages. Okay, so there you have it. That's our complete 4-part scorecard for what an ideal innovation should look like. But remember that little twist I mentioned earlier? How does this ideal scorecard compare to what we actually focus on in the real world? Well, this is where the research comes in. A big systematic review from 2024 by a researcher named Madden went through tons and tons of studies on healthcare innovation just to see what they were actually measuring. And the results, well, they're pretty fascinating. So the good news is that, yeah, innovations generally do have a positive impact. But The data shows this huge imbalance in what we choose to measure. A staggering 75% of the metrics are all about the system, things like utilization, efficiency, clinical performance, and that leaves just 25% for what patients are actually experiencing and for their safety. So, what's the bottom line from all this data? It's that we have gotten really, really good at measuring how an innovation affects an organization's performance. But we're way less focused on measuring how patients feel about it, or even on tracking safety as closely as we probably should. So, this leaves us with a massive question. Our real world scorecard is packed with things that are easy to count: costs, time, the number of users. But what about the things that are harder to measure, like fairness or the human experience? If our scorecard is unbalanced, then the future we build with it is probably going to be unbalanced too. So, are we measuring what truly matters?